Good afternoon, everyone. Welcome back. Thank you for joining us. We're glad that you're here. I'm Steve.
And I'm Scott.
And together we're Backyard Musings, Science and Technology channel.
Yeah, and today we are talking about a pretty common thing that a lot of people are doing these days, and a drug related to that. So, kind of interesting.
Yeah. A once niche herbal drug is now sparking a nationwide surge in poisonings, hospitalizations, and deaths. A new analysis from UVA Health reveals a sharp rise in calls to U.S. poison centers related to kratom, K-R-A-T-O-M, a drug commonly sold in vape shops and gas stations. Between 2015 and 2025, these calls increased by more than 1,200%, alongside a significant jump in hospitalizations. The researchers have published their findings in the Federal Centers for Disease Control and Prevention's weekly bulletin, the Morbidity and Mortality Weekly Report. The research team consisted of Eleanor Blair Towers, Ynhi T, Thomas, Holstege, and Farah. Would you like to know more?
This is kind of concerning.
Yeah.
In 2025 alone, poison centers received a record 3,434 reports, compared to just 258 in 2015. Researchers say this rapid growth reflects both a wider availability of kratom and the increasing strength of newer products. Serious health outcomes linked to kratom have risen dramatically in the past decade. Hospitalizations involving only kratom climbed more than 1,150%, increasing from 43 cases in 2015 to 538 cases in 2025. When kratom was used along with other substances such as illegal drugs or antidepressants, hospitalizations rose nearly 1,300%, from 40 to almost 550. Crazy.
Scott, what I don't understand is, like, if cigarettes 10, 20, 30 years ago was causing this jump within a 10-year period, they would have shut big tobacco down instantly, right?
Yeah, except it's big money. It's big money. And I don't know, maybe this is the same way, but you're right. I mean, I never could understand the vaping interest. Why
it's
just
people something
would do
to do. It's like a nervous, like, put it up to your mouth, breathe it in. It's like a nervous tick kind of thing.
Yeah. And it's, but I mean, if you look at the expelling vapor that people have, like if you're behind a car and their windows open and they're vaping and they blow it out, I mean, it's like their car's on fire.
I know.
And I'm thinking, my gosh, if you're inhaling that stuff, it can't be doing you any good.
The reason why I made that initial statement is because they're shutting down big tobacco because of lung disease and lung cancer. But if they would have saw this, I think they would have shut them down a long time ago. Why isn't this drug getting shut down immediately by the FDA? That's what I don't understand.
Yeah, I don't know.
Over the same period, 233 deaths were associated with kratom use. Again, K-R-A-T-O-M, including 184 cases where other substances were also involved. Quote, the data reflects a concerning trend, that's putting it mildly, said researcher Chris Holstege, medical doctor, the director of UVA Health's Blue Ridge Poison Center. Continuing his quote, this trend found in the national data is also occurring in our local clinical practice, with more patients presenting to UVA Health following serious complications associated with kratom products.
Kratom is derived from the leaves of a tropical evergreen tree native to Southeast Asia. Traditionally, people have used the leaves by chewing them, crushing them, or brewing them into tea for pain relief and mood improvement. The substance can act as both a stimulant, boosting energy, and a sedative, promoting relaxation and
reducing anxiety. Time out. How can it do both stimulant and sedative? Come on.
Yeah, it's the miracle drug. I don't know. How does it do both?
I don't know.
Yeah, I don't know. That's crazy. It has also been used to manage pain, and some individuals have turned to kratom to help with opioid withdrawal. Okay. Its effectiveness in reducing opioid cravings has not been thoroughly evaluated.
Hmm. In the United States, kratom is widely available in forms that are often much stronger than the natural leaves, including pills and extracts that may contain undisclosed ingredients. Because these products are not regulated, oh dear, consumers cannot be sure what they are taking. Kratom itself has also been linked to potential liver damage.
Not good.
No.
Prompted by the drug's growing use and potency, UVA Health researchers led by Rita Farah, PhD, MPH, PharmD, examined kratom-related calls using data from the National Poison Data System. They found that reports increased steadily from 2015 to 2019, leveled off between 2020 and 2024, and then rose sharply again in 2025. Okay, so why is that? That's a relatively short period of time. Why is that? Why did they have a leveling off period? And that's kind
Probably,
of that was COVID.
COVID, yeah. And so people weren't getting out and going to convenience stores or liquor stores.
That I guess makes sense.
And then there was an explosion of vape shops. I mean, a lot recently opened up in the last decade.
Yeah.
You didn't see that before a decade ago.
Right.
Across the 10-year period, more than 14,000 kratom exposures were reported. Most cases involve men, especially those in their 20s and 30s. However, reports also rose significantly among people ages 40 to 59, suggesting broader use across age groups. Researchers describe the trend as concerning. In 2025, 60% of cases involving multiple substances led to serious medical outcomes, and about half required hospitalization.
Yeah, and how many are we missing because they're not supposed to have it, and that's sub 20-year-old kids.
Yeah,
they can't buy this stuff, or 21 or whatever the age group is. I don't even know what it is. Can you buy it at 18? I don't know. Maybe not. I mean, not legally, but it's like stealing your parents' cigarettes or tobacco or whatever. So scary deal. And then what is it doing to the kids' lungs that are still developing? Based on these findings, experts are calling for closer insight of kratom products and stronger public health messaging. And we all know how that did with tobacco, right? They emphasize that using kratom can lead to serious and even when combined with alcohol, medications, or illicit drugs.
Quote, we're experiencing a marked increase in kratom-associated products being sold in the U.S. market, Holstege said. We want the public to be aware that these products contain chemicals of varying concentrations such as mitragynine and 7-hydroxymitragynine that have complex pharmacological actions and can cause drug interactions and adverse consequences in humans.
Again, that's another thing. You mix this with alcohol, you mix it with another drug. You don't even know. I mean, it's too new. It's like
stay away from it.
The vaccines that we were taking for COVID, they were throwing those things out there, and now we're finding people that are being affected by that. So crazy. But you're right. There needs to be more control of this stuff, more testing. And I'm not a big guy to test, but when you have numbers like that, that's a huge rise.
Yeah, you got to look into it.
Absolutely. So, all right, everyone. Well, thanks for listening. We'll see you this afternoon or see you tomorrow.
See ya.
Take care.